But there's a very new drug that has been approved, which I'm not necessarily using for my patients, but it has been approved by the FDA very recently, and it's the first biologic drug that has been green-lighted for treating lumbosacral pain, that's pain in your lumbar or in your sacrum, your lower back, that is radiating down your leg. So it's a drug called Condoliase, and it's used for nerve pain associated with lumbar disc herniation. So that means you have discs in your spine. They're little, between each of your vertebral bodies, there's little discs, and sometimes it can herniate out. It can bulge out. And so what can happen is that can cause pressure on the adjacent nerves. So you might have pain, neuropathic pain, meaning that's pain central from your spinal cord, that is causing pressure on those nerves, on those nerve roots, and you start having pain down your legs. Most of the time, this pain resolves on its own. But every so often, we have patients, about 15 to 40% of patients develop chronic pain. The pain doesn't go away. And so then we have to find a way to treat that. Most patients, they try medications, they try over-the-counter medications, your non-steroidal anti-inflammatories, your NSAIDs, they may try ibuprofen, they may try, maybe go even further, they may try narcotics in the early stages. But you don't want to be hooked on these drugs. So one of the things that we then go to is maybe we start doing injections, epidural steroid injections. But we found those aren't always that useful, and they're only good for a short period of time. So this is where this new drug comes into place. So Condoliase is actually an enzyme. It's an enzyme that what you do is we go into that disc and we inject it into that disc. And that enzyme breaks down that disc that is herniated out, that disc that has kind of popped out of place, and it starts breaking down the inside of that disc. So what that does is, this enzyme is actually made from a bacteria. It's made from gram-negative bacillus, okay? It's actually a bacteria that's out there, but it's an enzyme that's been pulled from that bacteria. And so that enzyme goes and it degrades the chondroitin, which is a sort of a material that you have within your disc. And by having that part of your disc break down, shrink, that actually causes your disc to sort of shrink back into place.
Wow. That's
yeah,
fascinating.
exactly. So that's something that's new out there.